I am going to start with sharing a PowerPoint. Okay, so now all of you know that, in functional medicine, we use a lot of supplements and herbs as well. And sometimes it's many of you feel overwhelmed because of the number of supplements sometimes we may recommend. And back in my early days, I never used to ask whether you're comfortable, in using so many supplements, because some of you are already on prescription medications, and it just feels like you've traded the prescription medications for more pills. But the fact is, each person is different. Some of you have come to the practice, carrying like a huge big bag of supplements, and then we've gone over them, deciding which ones you absolutely need, which are mission critical, and which are, stuff that you don't need. But quite often I have found many, and some of you have sent me, pictures of what you're taking. And I always tell you, I really don't know if this is not a supplement I have been using or I'm familiar with, particularly the supplement company. There isn't much I can help you with, because from the label, it is very difficult to know sometimes about supplement quality. So while I do hope you are able to make better judgments after the webinar today, it is still very difficult to know about supplement quality all the time, unless it's like, you've been using it for a while and you know a lot about the company and the process of the quality control and all of it. So first and foremost, why should you be concerned about supplement quality? So what happens is, as supplements and pharmaceutical medications are controlled differently. So the FDA does not, look at the supplement, does not regulate supplements the way it regulates pharmaceutical products. But some people are under the wrong impression that if a supplement is something natural, it is by default, harmless. That is not quite true. And that is one part of the problem. The second part of the problem is, because FDA does not control the quality, so these are the problems, as you can see, that does not contain what it claims on the label. Then there are contaminants, heavy metals, prescription drugs, and fillers. See, prescription drugs have no place in a supplement. So why are they there? Then all the entire contents of that particular supplement are not even listed in the label. So these are things that they are supposed to do, but they don't. So they have looked at, many studies have looked at, actually, they just bought supplements from the health food store and they decided to check what was actually in there. So the good supplement companies, they voluntarily give their products to a third party for analysis, so that they know that this is what I say it contains, and this is exactly what it contains, or at least within the acceptable range. So these are the problems, and you can never make out a lot of that stuff by just looking at a supplement label. So this was a study. This is from Ontario. This was, I think, 2015. What they decided to do, melatonin is one of the commonest supplements people use. They looked at, I think it was about 31 different supplements, where they analyzed by a process called liquid chromatography. And what they found was like really shocking. So this is what they found. Now, melatonin content varied from minus 83% to plus 478% of the label content. So imagine you are buying a melatonin which says 3 milligram on the bottle, but it is minus 83%. So what does it really contain? Hardly anything. Then the other big thing was, let us say you bought a particular melatonin of one company, and next month you go to buy the same one, the content may not be the same. See, lot to lot content varied by as much as 465%. These are not small numbers. Serotonin was identified in 8 of the supplements at levels of 1 to 75 microgram. And many of them obviously did not label it as serotonin containing in that particular supplement. So if you are, if you ever wonder why a certain supplement either doesn't seem to work for you, or, you seem to get a lot of side effects, these are some of the possible reasons. So if it doesn't contain what it's supposed to contain, or it contains too much of what is labeled, obviously you're not going to get the same kind of results. And the fact is, with melatonin, okay, that is, these are, so from the, from wrongly used, or even you may have used it correctly, but the thing is it was poor quality products. 23,000 emergency department visits and 2,000 hospitalizations in the United States each year. This is not from the melatonin study, but this is in general from herbs and supplement use by patients. And some of these were also inappropriate use, of course, but some of them were problems because of the supplements themselves. And the fact is, these were not like very simple stuff. How serious were they? Things like stroke, acute liver injury, kidney failure, pulmonary embolisms, even death. Now, about acute liver injury, one of the things that I've started insisting of late is, if any of my patients are using some kind of herbal supplements, like they think that Ayurvedic or one of those with multiple claims, those are supposed to be safer because they are like natural. There is a doctor, you can check him on Twitter, the liver doctor, Dr. Phillips. He's from South India. He regularly posts about the numerous patients who have had problems with liver injury from taking a bunch of all these different herbals and stuff like that. Some of it has been because of the numerous heavy metals and all those things that these contain. So that's very serious, and some of his patients have died of liver failure. So my point is, just because something is supposed to be Ayurvedic, or I don't know, natural or whatever, it may not be. I mean, don't assume that just because they are not a prescription medication, they are safe. Some of them may be unsafe because of the contaminants they contain. Some of them may be unsafe because of the interaction with all the other things you're taking. So it's important to keep that in. And there are tools to check. So when I recommend any, herb or supplement to anyone, supplements are not as much a problem. But herbs, I usually check the drug herb interaction or herb interaction. There are lots of tools online available. You can check Medscape for that. So how will you judge a supplement quality? Like I said, there is no, it's not it's not absolutely 100% guaranteed you will still know, but it's important to know what are the claims they are making. See, supplements and herbs by, rule cannot make claims about health. Like a supplement cannot say it will cure diabetes, it will cure heart disease. Sorry, at most it can say it will support your health. So important to understand what is, particularly in the web, on the website, what claims are they making? Now, secondly, if they are making a claim, is that substantiated by clinical research? So have those supplements that they are talking about, has it gone through any clinical study? Now, in the clinical study, it is also important to see a supplement, that company supplement which has gone through a clinical study, that particular company's, not a similar one in any other field. And they have gone through a clinical study which has gone through a peer review process. So they were not involved in the study. So that obviously has a whole lot more value than, for example, curcumin is one of the examples I usually give. So there are lots of studies on curcumin, and curcumin at different dosage, and curcumin containing piperine and all those things to increase absorption. But obviously all curcumin companies are not going to do their own clinical research. So they will post it in such a way it sounds as if their supplement has gone through the same kind of research. So that is not always true. Curcumin by itself may have gone through many research, but their specific product may not have gone through the same rigorous research. Then the other thing, of course, is where do they get their raw materials from? So some of the supplement companies that I use, or my associate Dr. Iyer uses here at the office, we have gone to those factories and taken, gone through the entire process of how they manufacture that. So what they told us is sometimes it is very difficult to maintain the quality control of the raw materials, because the vendor might have sent, a certain sample, and the sample may have passed their test. So when they test it through, there are very sophisticated testing, facilities available. So the sample may have gone through the testing procedure and passed it, but when the vendor sends actual bulk supplies, many a time they have found that it does not match. So the sample passed the test, the actual product, the bulk content did not. So they have had to send that back. And sometimes there are many factors, it's like, for example, if you look at curcumin, where was it, extracted from? Was it planted well? Then the temperature control in, while storage, while transporting it. There are so many factors that impact quality control, that unless the supplement company does not have the quality control in place, it is very difficult for, anyone from the outside to know, just based on looking at the, at the particular bottle. And many of the companies who are very sure of their quality control process, they are happy to share that information with you. But many companies, obviously this is an expensive process, because the equipment required is also expensive. So they will not, go to the trouble of sending you all that information. Now, there is one website called consumerlab.com. Of course, to get some of those reports, you have to pay some money. They analyze a whole bunch of supplements and, skincare products, lots of stuff. And they are a third-party testing company. And they come up with reports. So reports of showing which were the companies which have passed their tests and which haven't. So that is also an important, if the particular supplement you're looking at has passed a consumer lab, analysis, then you know that this is more reliable. So that is very important. And most of the time what happens is a lot of companies don't can't control the raw material, because they don't have, let us say it is something like, milk thistle or echinacea. Now, one echinacea company found out that whatever their vendor had provided to them didn't contain any echinacea at all. So obviously, if they had, put that into the capsules, it would have contained nothing. Then some things like, for example, one big one is fish oil. So omega-3 fatty acids made from fish oil. Now, obviously, for the fish as well, the fish can contain a lot of heavy metals contamination. And if the company does not remove those heavy metals from that particular fish oil, then of course you're getting, a heavy dose of those heavy metals when you're having that particular omega-3s, versus a company which removes all those impurities and all those heavy metals and things like that. That company may not be able to provide you with the capsules at a much lower price, because all these things, high quality does involve, spending more money. So, and sometimes it's not even, how much the supplement costs, because you don't know if the company has not shared with you their process, or at least what are the quality controls they look at. Then just because something costs more doesn't always mean it's better. But at the same time, if you're going for the cheapest one available, I would say that, just think twice, because you're paying money for something which may not be, like, if it is minus 83% of what it's supposed to contain, then obviously you're just, paying your money for something that is not really there. Then, so that is all from my side about, the different supplement quality. And I'm, it's open for questions now, but a few things I wanted to add is, one is supplement versus herbs, because supplements are things that you are supposed to have. Anyway, you're supposed to get that from your food. And the term supplement itself means that you're not getting it from your food, or you're not getting adequate quantity from your food. So you are going to supplement that with nutritional supplements. So things like magnesium, omega-3 fatty acids, vitamin D, then, so these are the three that top ones. Then CoQ10, coenzyme Q10. These are supplements. That means your food, and again, the reason is not just that it's not enough in our food. It's also there are so many other factors deciding how much of a supplement you would need. So you're not getting them from from your food and other resources. That's why you need to add them through a nutritional supplement. Now, what are the other factors which will decide whether, your supplement requirement? And before I move to requirement, let me just say a few words about what are herbs. So something like, for example, uh, valerian, or what are some of the other herbs we use? Maybe echinacea is another one, quercetin, curcumin. These are herbs, so they are not, they are not in the sense that you do not need a certain amount from your food, but they have benefits which will help you achieve a certain health goal. So, and obviously you always need to look for interactions between your whatever prescription medications you're on, interaction between other supplements as well. So herb drug interaction, herb supplement interaction, those are extremely important. Then there are some other interactions which you can't always check, because that could be some genetic variation that you have and that genetic variation can impact how your body metabolizes that particular substance, and that applies even to prescription drugs. So in the liver there is a detoxification system, and without going into much of the details, it's a cytochrome P450 pathway. So those are genes which impact certain enzymes. And CYP, 450 pathways, there are numerous ones. Some of them, some small genetic variation may impact how quickly you metabolize something. Some of them may impact how slowly you metabolize. And the other important thing is, if the same pathway is utilized by, drugs and hormones and, endocrine disrupting chemicals, and that pathway is not very efficient, obviously, that is one area you need to look at, because if you're overcrowding a pathway which is not very efficient, obviously it can cause problems. I won't say it will cause, but it can cause. Then the next thing is, when I look at supplement recommendations, usually my first question is, are you open to adding another, 3 or 4 more supplements? Some of you will say, oh, no, doctor, I'm done. Like, I can just have maybe one more extra pill. So in the supplement world, in vitamins and minerals, what happens is each of them impact one certain pathway. So let us say, for example, you take, B vitamins. Now, usually you'll hear us talking about B complex versus individual B vitamins. So a vitamin B12 test is available anywhere in the world through a routine lab test. So if you find that your vitamin B12 levels are low, does it mean that you are, sufficient for the other ones? No, you haven't tested, number one. Number two is, a routine lab test cannot always tell you about everything. For example, a routine lab test for folic acid in blood will not tell you what your folate levels are at your tissue level. So that's a different test called FIGLU. A FIGLU is not something we recommend usually, because number one, it costs money, and folate is not something that you're going to get too much of if you take sufficient quantities and not overdose on them. The thing I wanted to highlight is vitamins, minerals, and these kind of nutritional supplements, they work like a network. So if you are just taking too much of one and you are deficient in all the others, what is going to happen? Obviously, if one pathway is dependent on 3 different nutrients and you are only adding one and not the others which you are deficient in, it's not going to work the same way. So in traditional medicine, and on all my previous webinars, I have usually shown my silo versus the network of network thinking. So in traditional medicine, we are used to looking at one disease target, one drug which impacts one particular pathway. But in nutritional supplementation, that doesn't exactly work, because, like I said, you are deficient in 4 nutrients, and that same pathway is affected by 4 of them, and you are only taking one out of that whole lot. So obviously you're not going to get the best results. Then another big difference is the bare minimum of supplements. So that is called the RDA, recommended dietary allowance. Now, RDAs were, decided at a time when we were still looking for deficiency diseases, things like, rickets and scurvy. Now, today's time is not, most people are not going to be deficient to that point where they're going to get scurvy or rickets or any of that. But no studies have been done to look at what does a person today, let us say a middle-aged woman who is past her menopause, who is working 24/7 almost, and has a huge amount of stress. She's taking care of elderly parents. She's herself running a business. Now, what is the requirement for someone like her versus the RDA, which just looks at meeting the bare minimum? That is one thing. So RDAs will not decide, what is necessary for you. That is just about the bare minimum. What we look at is what we talk about as therapeutic levels. So therapeutic levels means you are looking for a specific health effect. Now, for many of these vitamins and minerals and micronutrients, the therapeutic levels are way higher than the RDA levels. And that does not mean it's unsafe, because for most of them, safety studies have been done. So if you are buying something from the health food store, most of the time they don't contain the therapeutic levels, and you can actually compare what is available in. So let us say this is a supplement which has been used in a clinical study independently. The supplement company has not run the study, but an independent researcher has run the study. And you can usually, most of these people, these research papers will share the contents of what they have used. You can compare the contents of one of those products to what probably you're buying from the health food store. In fact, some of them are so specific that even the supplements that we recommend or we use for ourselves, even they may not meet all the requirements. We need to have more of that. So the point is, it's not so simple to just say, okay, just take this, and you can't sleep well. If you can't sleep well, just take some melatonin. Well, yes, it can work, but because melatonin is again a supplement, so your body is supposed to make it. But some of you will tell me, oh, melatonin doesn't work for me. So then, of course, I have to ask, where did you buy the melatonin from? How much was it? And how did you have it? So ideally, in the ideal world, I would love to test, a saliva melatonin levels for everyone. I haven't even done it on myself. And that's a saliva test. You have to spit into a tube. And the one for melatonin, it's like in the middle of the night, you shouldn't switch on the light because light will impact your melatonin levels. And in the darkness, you're going to spit into a tube. That is one, it's troublesome. Next is, it of course costs more money. Then you can, of course, test for melatonin in urine. Now, urine melatonin, if you are taking a melatonin supplement, that report is not accurate. You will find that the numbers show like in thousands, and you are left wondering, am I taking too much melatonin? Is it going to kill me? No, that test is not accurate for people who are taking melatonin. So there are so many nuances. Some of the supplements, some of the vitamins and minerals, even, a routine lab test may not be able to tell you how much you need. For example, magnesium. The magnesium in blood will not tell you how much magnesium you need because it does not reflect the tissue level. And most of the magnesium in your body is in the bones. And we cannot know that from a blood serum magnesium level. The right test would be an RBC magnesium, which is not available in many countries. It's a specialized test. You need to spend more money. Versus, I have a more, usually a more practical recommendation in, see, magnesium is a supplement. So if you take too much of it, you will likely get diarrhea. So how do you start with magnesium supplementation? Take 3 capsules at bedtime. And I usually recommend that take 3 more in the morning. If you have developed diarrhea, then you know that that is too much magnesium. Then you need to, back down to the level where you don't have diarrhea. Again, does this always work? No, some of you don't have diarrhea even at much higher dose. Then ideally doing an RBC magnesium would be good. But there are different ways of looking at it. Versus something like, omega-3 fatty acids. As I always say, why guess when you can test? So omega-3 fatty acid testing is available in many countries, and it's a dry blood test. So it's not like shipping a saliva sample or something internationally, which is a lot of problem. So that can be done. And some of you are surprised to see, you are taking an omega-3 supplement and you eat adequate fish, but you find that it's not enough. And sometimes you're surprised by your omega-6 levels. Omega-6 and omega-3 have to be in a certain ratio, and most people all over the world usually have more omega-6 than omega-3 in their blood. And lower levels of omega-3 won't usually show any symptoms, and there is no routine blood test available to check that. So you have to get a specialized testing done. The other thing is, can you overdose on, like, let us say, maybe 3 grams of omega-3, which is a combination of DHA and EPA? No, but it will depend on, we have to go through the entire this thing. So one common myth is, if you take omega-3, your blood is going to stop clotting. No, that has not been seen. Studies have not supported that. In fact, high dose omega-3s are recommended as a prescription medication now to reduce levels of triglycerides. So triglycerides are one of the bad fats in your blood. So there are many different nuances. Then the other thing is, sometimes you may, let us say, I recommend, this has happened recently, I recommend a certain supplement. This one was CoQ10. And coenzyme Q10 is very important for your body because it is involved in the making energy and making ATP. ATP is the energy source of your cells. And if you do not make enough ATP, that is a problem. So that is what, mitochondrial dysfunction and all those things come in. And coenzyme Q10 is very important for you to make adequate ATP. That's one of the components. Magnesium is also necessary for that, and a whole bunch of other supplements as well. And as people age, their normal levels of CoQ10 in the body diminish. Then there are some medications like your statin medicines. So the medicines used to lower cholesterol levels in your blood, those medicines eat up the CoQ10 level. So they cause depletion of CoQ10. So sometimes we don't even necessarily need to test for everything, because the right test may not be available in your country. And I always look at, what are the pros and cons. If I recommend 300 milligram of CoQ10, is it going to be harmful for you? Very likely not. So number one is, how do you decide? The older, above 50, you need to add 100 milligram of CoQ10. If you are on medications that reduce your levels of CoQ10, you need to add another 100 for that. So it's not like, 50 milligram of CoQ10 is going to take care of all the problems in your body. And then you come back saying that, oh, it didn't really work for me. The problem is you probably didn't get the adequate dosage. So, but the fact is, your physician may have no idea about what CoQ10 does. And then so my patient was told, oh, these supplements are like, they are useless, you just make expensive urine. The reason he said that was he has no knowledge about it. So just as, I don't know about, let us say, cardiology and angiography or angioplasty, what particular stent you should use. Likewise, your cardiologist may have absolutely no clue about nutrition or nutritional supplementation, because that is not what they have studied. This is a very specialized field, and sometimes people feel that just because these are nutritional supplements, they are supposed to be natural, you're supposed to get them from food. It's like you don't really need a lot of knowledge or anything, and it can just take a little bit here and a little bit there, and you should be fine. So when I make supplement recommendations, number one, I look at, let us say, for example, something like omega-3 fatty acids. They have so many wonderful benefits. One is inflammation, and there are very few people I know who don't need lower the inflammation levels. Brain function, heart benefits, of joint pain, mood. There's so many different areas that omega-3s impact, that is one of my favorite supplements to recommend. Then comes something like magnesium. Now, magnesium is involved with 300, 400 different reactions in the body. So obviously, and you can never get enough from food. You need to have 8 cups of spinach every day to get just about 320 milligrams of magnesium, and that may not even be enough for you. So magnesium is another one, because it's involved in so many different reactions in the body. Blood glucose control is one, mood is one, sleep, anxiety. So magnesium is my other big favorite. So magnesium, omega-3 fatty acids. Then comes, let us say vitamin C. So vitamin C, again, it helps in lowering blood pressure. It helps in lowering uric acid levels, but you need to take more than 250 milligrams. So most of the therapeutic benefits would come at 1500 to 2000 milligram. So if you feel that the vitamin C that you're taking, which is just 250 milligrams, is not helping you, the reason could be you're not on significant amount of it to give you a therapeutic benefit. So the therapeutic benefit versus the RDA, you always need to balance that. And that obviously needs some knowledge, just because these are supplements, you cannot just treat them as, oh, anyone can just tell you what to do. And definitely your doctor may not be the person unless he or she is trained and educated in this field. So I think that's enough from me, and it's open to questions. You can either type in the Q&A or in the chat box, and I will respond to them. I don't see any questions yet. And if you think of something later on, just feel free to email me at my office email, info @drkarmd, drkarmd.com. And next month, before that, of course, I'm going to send you an email telling you what the next few topics are, and your topic suggestions as well. And bye now, and thank you for spending your time with me. Bye.